they connect to branches of other arteries that have done the same thing. So they're basically endpoints of all the blood vessels, and they're meeting each other at certain locations in the brain. And what causes those kinds of strokes is when the blood pressure suddenly goes very low. So in other words, there's not enough blood flow into those blood vessels of the brain basically at the same time. So for example, if someone had a heart attack or went into cardiac arrest, the heart's not pumping blood, and so the blood's not getting into the brain as normally as it would otherwise. And so the very far ends of the blood vessels within the brain are going to be the farthest away from the heart, so that's where the brunt of the damage will occur. And they call that the watershed area. So what that means is it's not a blood clot that went to the brain and caused a stroke like the classic strokes that people think about.
Right.
And it also means that it's not a cause from plaque that has just kind of narrowed down and then closed off a blood vessel to cause a stroke. This kind of stroke was caused by a sudden lack of blood flow to the brain. And so usually that's, when people pass out or their heart maybe stops pumping for a short bit of time, that can be a cause of the lack of blood flow to the brain. And those areas of the brain are going to have the highest risk of injury.
Okay.
So it kind of fits with this idea that, she passed out there for whatever the reason was, and the brain sustained an injury, and it may just not have. Those are hard to see on a CAT scan. So if they did a CAT scan when she first went to the ER, they probably were not able to see this.
Okay.
And so then you go home, and the damage that happened is increasing. In other words, the injury happened, but now swelling and changes are happening in the brain, and that may account for why you got home and things went south again, because now the brain is starting to react even more from that insult that happened previously. And now if you do an MRI, you could see it pretty clearly.
Okay. Her left arm is completely numb. She can't lift it or move it. Is that causing that?
Yes.
Okay. So what?
And you mentioned the facial droop. Does she still have the facial droop too?
Yes.
Okay. Because that would come from this as well.
Okay.
Are there other deficits? Anything else that's different?
Well, she's extremely weak. She can't stand up. At times, they ask her, like just now, where she is. Do you know where you are? She said she was at home, not in the hospital. So, cognitive, but she's on. They gave her this muscle relaxer. I think it's Pavlox.
Yeah.
Mispronouncing it anyway, and that's made her really drowsy, and she hasn't been having that cognitive Plavix. I'm sorry, she hasn't had this cognitive issue of not knowing where she was and so forth, and she's just kind of loopy, and I think that's one of the side effects of that muscle relaxer, from what I've read.
Yes.
Yes. So, how serious is this? Is that something she'd be able to recover?
Oh yeah, no, absolutely. People recover from these. It's definitely recoverable. I think the issue is going to be how much damage occurred, and I'd really have to kind of see probably the scans or the report to get a better feel of that.
Okay.
So it's a little hard to predict just from hearing the words, but no, people recover from these, And the good news is it's not like an artery that closed off or a blood clot that shot up there. Those are sometimes harder to recover from, and
Right.
then you're also trying to still treat whatever caused that stroke to make sure it doesn't happen again.
Right.
But now I think we have to figure out, why did this whole episode happen? Did it happen because, like you said, she was straining and she just kind of had a passing out episode from
Right.
the whole episode in the bathroom, or did something happen with the heart? I think that's where we have to kind of look next.
Okay. Yeah, I asked him about they did an echo this today, and he hasn't seen the results of that. So that may tell something.
Yes. Yeah,
Okay.
that was a good idea to do that.
Okay.
Yeah, but they don't have to do a whole bunch of other tests typically to kind of work up the stroke. Usually, what they've done so far may be all that's necessary, but we'll see what they find or what they recommend. But try to do as much as you can while you're there that they recommend, because you know how it is. It takes forever to get outpatient tests done.
Right.
So it's going to be a lot more efficient to do it while she's there and get it done quickly. And that way we have all the data,
Right. Yeah, they're running all sorts. They've run all sorts of tests.
Okay.
So,
Okay.
is this something that will deny her from the clinical trial?
Oh, no, not at all. Not at all. No. No, I mean, she's, things like this can happen, and it doesn't kick anybody out from the study. She can continue on, and we just have to make a note of it, that it happened, and we have to turn in medical records. But no, it doesn't affect us at all. In fact, if we have to skip a month to let her recover, we can. There won't be any penalty for that either. So, there's no rush in having to get the next infusion in. But if she's home and she's recovering and she's up for it, we still can do it. Or we could push it back a week or two, give her a little bit more time as well. So you just let me know how she's recovering, and because she's probably going to be in PT and some other things here now.
Yes.
Doctor just came back and said echocardiogram was normal, so it's not her heart.
Hey,
no, you heard that.
Good
Okay.
news. Okay.
Yeah.
Okay, that's
Great.
good.
Good news.
That's good. Yeah, they're gonna. She's not able to go home now. I even know that. So they're gonna, put her in PT. We're hoping and shooting for have her in PT here in the hospital. Because they have a good unit here. So that's the plan, and
good.
she'll probably be there. Who knows how long? 10 days, whatever the insurance, lasts for long.
Because they know the best, of course.
Yeah, that's right. But I know we have a appointment with you on the 25th, so that's probably not going to happen.
Well, don't worry. We'll be in touch with you, and as we get closer to that, we can always bump it out, or if we need to, or we can keep it. So no worries. We'll make it work. So don't worry about that. You just focus on getting her better and getting her therapy and all of that. But I don't know what they're going to recommend as far as medication, but all of them are compatible. I mean, nothing is contraindicated. So if they decide to do a blood thinner, or if they decide to do anything else, just feel free to do it. It's not going to interrupt anything.
Yeah, she's real leery of a blood thinner. She does not want to do
and I
that.
don't know that she needs one, because this wasn't really a blood clot situation.
Right. Okay. Okay.
So she may not need to take that at all.
Okay. Yeah, they're going to do a Zoom call with. They did one last night about midnight and they have a laminated sheet of paper that says teleneurologist, telestroke, And this guy, he asked me, okay, what brought you in here? And I said, well, first she's in Parkinson's. She has Parkinson's in a clinical trial. And he said, I don't want to know the background. He said, just tell me what happened. Well, this is kind of what happened, is that she, is constipated, and this is leading to it. But anyway, he didn't seem to. He did a lot of the tests, that Shannon does with her, you know,
Yeah.
or had the
Yeah.
nurse do him, and he was watching. But anyway, I don't know why they can't use somebody from St. John's in Tulsa or Ascension.
Right.
Maybe he was. Anyway, okay, that's here and there. I will keep this, and I'll ask him questions when we get to that point too.
Okay.
But I can't tell you how much we appreciate you.
No, of course, and I'm sorry this happened, and we're here for you guys, both of you. But I was going to ask you, did they get cardiology involved at all?
I don't know if cardiology. They must had they had a remote, a Philips echo unit that came here and did it. It was a portable. I'm sorry, it's stuck for words. It's a portable unit, and so I assume they were from cardiology. But
And she's not on a heart monitor, is she?
no, she's no.
Okay.
No.
Okay. Well, because they may say you might ask the neurologist or the hospital doctor there too, both of them. You might ask them, should we be concerned at all about that this whole thing was caused by a heart rhythm change that caused her to pass out? And they may say something like, well, her EKG was normal, but that was done when she was awake in the hospital.
Right.
So so do they think? My question to them would be, do you think doing any monitoring of her heart, like they call it a Holter monitor?
Yes. Yes, I had
they
one.
hook you've had,
Yeah.
you've had one of those, right?
Yeah.
Yeah, where we could at least just kind of double check that she's not having arrhythmias that maybe could cause this to happen again.
Right.
The other thing to keep in mind is, it's rare, but Parkinson's patients have had seizures in the past. Now, we don't have any reason to think this was a seizure at all, of course, but I'm just throwing out a couple ideas of where the testing wouldn't indicate that had anything to do with this.
Yeah.
And they may get mad at you for even suggesting more testing and thinking.
Right.
but someone who's seen you guys a long time and wants her to be safe, I don't want this to happen again. So
right.
As much as we can figure out, was it just a happenstance, just a moment of passing out, or is she having heart rhythm changes that could happen again?
Right.
And so, and just because she had one normal EKG in the ER doesn't exclude that possibility if they say that.
Right.
Because you can come in and out of those all the time, just like you can have a seizure and then have a normal brainwave test after the fact, right? So, and anyway, I wanted you to be armed with that information in case you talk to them, just to throw out.
Good point.
What do you guys think about that? Or should we get cardiology to comment on that? Should we not?
Good point.
Because I would kind of press them and say, well, why would she have a watershed stroke? What would have caused that?
Right.
Because people pass out all the time and they don't have watershed strokes. So this was a big event. Something really cut off blood flow to her brain. And so what was that? How would they explain that to you?
Right. Okay.
And if you feel like they have no idea how to explain it, then you might say, it sounds like we don't really have a good idea. Should we ask cardiology to consult and just see if more testing would be helpful? What would you do in that regard? And if the end result is they say no and they dismiss it like you're crazy to ask that, we could always get cardiology to consult on an outpatient basis if you feel like you're not getting anywhere. But
okay.
I just wanted you to know that, because it's very unusual to have this kind of a stroke without a good reason.
Right. Okay. Yeah, we want to rule out, obviously, that it had anything to do with the heart, and that it was,
right.
A vagal nerve ending that caused it, when she stood up.
Yeah. Well, and there's no better time to have a Holter monitor attached to you when
Right.
you're in the hospital or if you're in the rehab center, that would be easier on her than doing it at home when she's out of the hospital
Right.
and has to carry it around.
Right.
This would be the time to do that kind of a test, in my opinion. But I'm not in charge, so.
Okay. Oh no, you're you're going to be in charge.
I'm a bystander over here at the moment.
Right.
but-
No, because you know more. You know more about it. You know more about her, and you know more about this than I think the others do here. So, okay, that's great. We will follow up with those questions, and I'll let you know
Okay.
what they say, and I will send you a photo of the report that they just gave us.
Okay.
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 And I'll
And-
send
and
that
most
to your.
importantly-
I'll send the photo to your personal number or to your office number.
Yeah. No, just to my personal number.
It's like 9268, something like that.
Yes.
Is it?
That's perfect.
Is it? What's the first three prefixes? I want to make sure that 85.
Yeah, the 852.
Okay, that's it. Okay.
Yeah. Yeah.
Okay.
And most importantly, give her a hug from us.
Okay.
Aw.
I will. Okay.
Okay.
Thank you so
Well,
much,
keep you
Dr.
posted.
Klaus. We words just can't express how much we appreciate you and value your opinion. It's not opinion, but your knowledge in this. So it makes a big difference to us.
Well, thank
So
you.
thank you.
I'm
Thanks for making the
sorry that
time
she's going
to
through
chat
this.
with me. Okay.